Back to 3+U, we are joined by Dr. Lee Perry from the Chattanooga Allergy Clinic. Good morning and thanks so much for being here. You know, it is back to school and also back to a lot of allergy problems for these students. What are some of the main problems that you see this time of year when parents bring in their kids?
I think the biggest thing to take home from today is just the asthma. And our asthmatics, when you head back into school, kids get exposed to lots of viruses and different organisms that can cause infection. And those infections are probably the most common cause of an asthma attack. So we want to make sure our asthmatics are on their proper medications, taking them regularly, and also have appropriate rescue medicines available to them at school.
And I think what's so important, and I know in health over the years we've tried to hammer home this point, but the connection between allergies and asthma.
Very big connection, and that's another thing that can trigger asthma attacks this time of year is ragweed. We're starting to see the ragweed emerge over the next few weeks. It's fall, so that's when all the weed pollen will be flying around, and Chattanooga is historically in the top 7 or 8 cities in the country for ragweed allergy. So we know that's a common trigger for asthmatics as well.
And one of the things too with the ragweeds, I remember earlier doing a story, there was new medication out, but you had to get that in early, right, for it to be effective.
Yeah, it's an oral immunotherapy treatment. So if you take, it's called Ragwitech. If you start taking ragweed pollen under the tongue, basically it's a tablet with ragweed in it, under the tongue 8 weeks prior to the season. So you're right, it's too late to start that now because you would have had to start that 2 weeks or 2 months ago.
Yeah.
But next year, if this is a season that bothers you, then that might be appropriate treatment for you. And
one of the things too, Al, just to talk about the new medications was with that and also with grass pollens as well, that but in both of these cases, you had to get them in 8 weeks prior to the season kicking in.
They're very unique treatments because traditionally immunotherapy or allergy therapy, the best treatment was always allergy shots. In some cases, in many cases, allergy shots still are better. For instance, if you have a patient or someone who's allergic to several different types of pollen, and they're allergic to ragweed, and they're allergic to cats and dogs, which we see a lot of here, then the ragweed tablet or the grass tablet might not be appropriate for them because you're only treating one facet of their allergy. Whereas if you have somebody who's just allergic to ragweed, nothing else, or just allergic to grass pollen and nothing else, then the ragweed tablet or the grass tablet would be perfect for them. It would save them from having to get allergy shots, and they could just take their tablet.
But again, that's only if they're only allergic to that one.
Right, because ragweed tablets can only treat ragweed allergy. It can't treat tree pollen allergy, which is in Chattanooga is probably the worst one.
Yeah, that's pretty bad around here. And kind of going full circle now back to the kids in school and getting back, one of the big things, of course, is peanut allergies.
Yes,
that's the most serious when it comes to food allergies.
Absolutely, and the biggest foods that we talked about earlier are peanuts, tree nuts, egg, and soy, and milk, and wheat. Those are the most common allergens that we see, but like you said, peanut allergy is growing in number, and it's the most severe. It's the one that we worry about being life-threatening. And we want to make sure kids, as they're going back to school, have those action plans set and make sure their schools, teachers and administrators and everyone that needs to know knows about these allergies so that they can have their avoidance measures in place and also their EpiPen in place.
And do you think that schools are doing a much better job now when it comes to making sure they have these plans in place and that they're aware of students who have these potentially life-threatening situations?
I think you definitely. There's much more awareness now, and we fill out forms like crazy this time of year, just making sure we have every child's specific food allergens on paper and with their action plan in place. So if they were to be exposed to this food and experience these symptoms, this is what we do, and that's always in place. And the schools are very good about making sure kids that are allergic to certain things are avoiding the foods as necessary.
And one of the things too, and I think that you were talking about schools and with kids doing a much better job now, I think that once the kids know about the dangers of these and parents have talked to them and doctors, you talk to your patients, that the students themselves do a pretty good job of saying, hey, I can't have any of that, or what's in this food, and they know what to do if they experience some type of reaction.
Absolutely. My 11-year-old, my oldest son, has severe peanut allergy, and he is just as cautious as anyone. And most, like you said, most kids that age and even younger, once they've had a reaction to peanut and know what it feels like, they're going to do whatever they can to avoid that trigger. So they're very good about asking questions and avoiding the food, but it always helps to have everybody at school on board as well.
All right, so of course we know, like we said, with school back in session, sometimes parents get lax over the summer with medications and routines.
Yes.
But it's time right now to make sure that you have those action plans
Yes.
and that the kids also are well prepared as well when it comes to their allergies and their health and safety.
That's right, and you're exactly right. In the summer, that we don't have as many triggers for asthma. So people are walking around thinking, well, my asthma must be gone now because I'm feeling so good. But when the fall emerges and these organisms emerge and people get colds and those kind of things, then the asthma seems to peak again. So we want to make sure they're on their proper medications.
All right, Dr. Perry, as always, great seeing you. Thanks
Thank
so
you.
much for being here. And if you have any questions about allergies, asthma, whether it's for adults or children, contact them at the Chattanooga Allergy Clinic. All their information right there on your screen. We're back with more 3 Plus You after this. Stay tuned.